there. Welcome to Foundations of Sustainable Weight Loss. This is just a video that's going to go over pretty much the group session for Foundations of Sustainable Weight Loss, a multifaceted approach to weight loss. My name is Bianca. I am one of the registered dietitians at Jack and Jill Health. Just want to walk you through what you can expect in this video. There'll be a little bit of an intro for me, as well as kind of introducing you to the dietitian team. And also we will go over weight biases, the concept of best weight, factors that influence body size. We'll talk about some of the treatments for elevated weight. We'll also talk about factors that can hinder your progress and building resistance. And then finally, we'll end off with talking through how to make goals, specifically smarter goals, to be successful in the program. So again, I told you I would introduce you to the dietitian team. So my name is Bianca Cordeiro. I am a registered dietitian based in Ontario. I mainly see clients in BC as well as Nova Scotia. I also see some clients in Newfoundland. I see pretty much most of the clients that the other RDs cannot see, everywhere except for in Quebec, and also Manitoba and Saskatchewan. But everywhere else, I am the go-to dietitian for. So then we have Jill Anderson, who mainly sees clients in Ontario. She also sees clients in Saskatchewan, and she's based in Manitoba. And we also have Alana, who is actually based in Alberta and sees most of our Albertan clients. So we want to start off with posing a question to you. Think back on any particular diets that you might have tried in the past. How many diets have you tried that actually did work, but were difficult to stick to? Just kind of reflect a little bit on that. You might have an answer in your mind. This might be something that perhaps maybe you haven't thought of a number around. And perhaps maybe you can think of diets that perhaps you've tried in the past that might not have even worked. So really just take the time to kind of think about it. Maybe if you want to jot it down, you can feel free to do that as well. So let's talk a little bit about weight bias though. So I'm just going to read out a quote for you. So weight bias refers to negative attitudes and views about obesity and about people with obesity. Weight bias has negative consequences, including feelings of shame and blame, anxiety, depression, poor self-esteem, and body dissatisfaction that can lead to unhealthy weight control practices. So I'm sure many of you may have come across some weight bias in the past. Weight bias can be pretty much anywhere and can be exhibited by anyone. So now we know a little bit about weight bias. However, our weight can fluctuate over time. Really, when it comes to the weight that we're best healthy at and feel best at, it can be a lot more different than what others might anticipate, and can also be quite different from what BMI might even tell us. So I'm just going to read out another quote for you. So best weight is defined as the weight one softly lands at when living the healthiest lifestyle they can truly enjoy at an effort level that can be maintained long term. So essentially, a long-term lifestyle approach that you're able to maintain without feeling fatigued or like overly restricted. Best weight rests on the idea that behaviors adopted to lose weight will need to be continued in order to maintain losses. So, really, achieving your best weight is not as simple as eat less and move more. Many of us might have heard from even medical practitioners in the past that all we need to do is just lower our calorie intake, eat, low fat foods, low carb foods, and just go out to the gym and exercise more. Some of these things might have been told to you, like even in the past, and they are definitely things that a lot of people get told, but it's just really not that simple. So let's talk a little bit about some of the factors that impact your weight management. So there are many layers and uh, like many factors that can impact your health and your weight. But specifically, we're going to focus on weight here. So, genetic wise, some of us are more predisposed to being at a higher weight. And so, with that, definitely what you might see is that perhaps maybe family members might be have elevated weight as well. So you might see a long lineage of that in your family history, even. And these can be some of those things that point to genetics as being a factor, but also the way your brain and appetite system kind of work together to bring about your actual weight can impact what sort of set weight you're at. So there's kind of the theory of like a set point where there's a point that your body wants to stay at in order to stay healthy, a specific weight that your body wants to stay at to stay healthy, and your brain will work, and all of your appetite systems, your hormones that influence your hunger, even like neural pathways, will all be working together to keep you at a weight that your body feels is most comfortable and is safest for you. Then there is environmental impacts. So those are think of like your food environment, your physical environment when it comes to accessibility to safe roads, even to walk. Safe sidewalks to walk on, or perhaps your access to a gym, even. And then you have your lifestyle. Think of like um, how busy perhaps you might be. People who are busier might have a tougher time being able to fit a lot of things in that can positively impact their weight management. So, really, there's a lot of factors, and these are just some of those factors that can impact your weight. So, weight really, what we want to get at the heart of it all, is much more than willpower. It's not about, having just the willpower to power through and be able to lose the weight and keep it off for long and stick with those habits, stick with the restrictive diet. It's so much more than that. It's so much more complex. And that's why we need to take a multifaceted approach at weight management. So let's talk a little bit about the genetic side of things. So approximately 70% of the variability of body size in all humans is inherited. So just think of it. 70% of that just comes from your genetics. So a lot of the times, perhaps maybe you might have seen individuals who don't struggle with their weight at all. Their whole family's like that. Perhaps they eat a ton of food, or They never get out to exercise. They never have a weight management issue. So when it comes to appetite, there are many hormones that are involved in regulating our hunger and satiety. So those also influence our weight changes over time, and so do the level of hormones that we actually produce. So again, as we even lose weight, our hunger hormones can change quite a bit, and our weight definitely impacts that because again, our body often wants to come back to a set point, the point that it feels most comfortable at, most safe at. Our bodies are pretty much hardwired to more more so hold on to weight to prevent risk of starvation essentially. So our appetite systems are quite complex and very highly adaptive to our fluctuations in weight over time to bring us back to a point where again our body feels most safe at. So, again, think of our food environment. Our food environment definitely has changed quite a lot. If you could think of over even the past 50 years, some of the foods that we have access to are quite different than what they were before. We have our ultra processed foods, foods that have gone through more than two or three or four processes in order to be at their final result. Think of things like your fast food chains that do a lot of making their food ahead of time using lots of, preservatives and kind of keeping things shelf stable, and also then frying those foods and processing them in ways that are considered highly palatable. So we have definitely more access to these foods now, that are what we call considered highly palatable foods that are high in sugar, high in salt, high in trans fats, or even saturated fat. These foods that typically before would have been way less processed, perhaps would be even, we would even eat more so of those whole foods instead, like the veggies and or fruits and whole grains and a whole bunch of other things that were way less processed before. And of course, a lot of this has to do with our growing population. We're trying to keep up with that. So we have a lot of quick, easy things that are going to cost even less than your healthier options. So just think of how that has changed over the last 50 years and also how that might have impacted our incidence of elevated weight. So, then we have the lifestyle piece. Again, this is something that has changed quite a lot in the last 50 years as well. A lot of us are sitting more, frankly. We're going further for work, commuting. It's everything is definitely more convenient to get to. Some of us uh, don't necessarily really even get out of the house as often, maybe working from home. I'm sitting right now. I'm sure maybe some of you might be sitting now, listening to this right now. So really our lifestyle has become a lot more sedentary than what it was before, when perhaps we did a lot more walking and carrying, perhaps like heavy materials, heavy bags, doing more physical labor based jobs. So really that has changed quite a lot for the majority of our population within the last 50 years. So let's talk about some of the barriers that we might have for achieving and maintaining your best weight or your healthiest weight. So again, weight is multifaceted. There's so many different things that impact your weight. Things like poor sleep can definitely impact things like your hunger levels, your energy levels. That might make it harder for you to be active or harder for you to be to eat portion sizes that are more reasonable. Um, Sedentary lifestyles. Again, we talked about how 50 years ago we weren't sitting as much, and now we're sitting a lot more. Uh, Poor management of stress can also be a factor. Stress hormones, the way we even deal with stress in general can impact our ability to lose weight and maintain weight. Just, think of things like, how we cope with stress in positive ways versus how sometimes we cope with stress in negative ways. It can definitely impact motivation, can impact your the amount of food or the types of foods that you might go to. Mental health, again, kind of along that lines of, impacting food decisions, perhaps impacting your motivations to do things like meal prep or going out to go grocery shopping or even going out for a walk. Those who suffer with depression, anxiety, may have trouble with some of those things, and even stuff like more developmental side of things like ADHD, and being neurodiverse can impact your ability to be able to actually choose, healthier options, and even be able to have motivation to do things like I said before, the meal prep or being active or even going to bed on time even. And then we have of course, the habits that we might have had left over from previous diets, like restrictive eating. Perhaps there's food rules that you've created for yourself that might be getting in the way, or perhaps even restricting how frequent you can eat. Going too long without food can definitely impact your hunger levels. Maybe there's been a time where perhaps you forgot a meal or were too busy to have a meal, and then at your subsequent meal was super ravenous and was finding it, you know, maybe you were finding it much harder for you to actually make healthier choices in the moment due to being hungrier. So that can definitely impact your ability to make healthy food choices when you're going too long without eating, and can also impact your ability to be able to stop eating when you're satisfied as opposed to when you're feeling overly full. And then there's also, having going all in way too quickly, that can impact things. So when you change too much too quickly, it can be overwhelming. And a lot of us can reach a moment of burnout where we feel kind of perhaps not as optimistic about our efforts anymore, or perhaps might feel as though, for what it's worth, perhaps it's, the what you're doing might be too much for the actual outcome that you're getting. So basically feeling worn down from your efforts. Perhaps maybe you decided to change too much of your nutrition habits all at once, or perhaps you're doing a really tough workout routine too often. So it's important to kind of slow that down because that can really impact your ability to achieve your best weight and also even maintain it. And then there's also that all or nothing mentality where perhaps there might have been times, or there may be times where individuals might want to, again, do everything they can to be physically active, meal plan, but perhaps maybe one week there's one thing that gets in the way. Maybe there is a visitor that's coming into town, or perhaps even maybe you're away out of town and you feel like, okay, well, if I'm away or if there's a visitor and I can't do my regular routine, then I might as well not do it at all. So there's also that mentality, or even if you're having lack of support, lack of accountability, even where perhaps um, you're not able to actually have an environment or individuals around that are going to support your efforts and might even hinder your efforts. That can be definitely a barrier that impacts your ability to actually even continue on, but also to in general make changes. uh, and then that accountability piece on top of it, if you have that accountability buddy, if you've ever had one before, you probably know how valuable that is. And that's why in our program we have our wellness aspect of things, so that we can also be here as accountability buddies for you, in order to set goals, follow up on them, because really having somebody to talk to about how things are going has been shown to be very, very helpful. Can even be helpful if you're around individuals who are trying to do something similar as you. Perhaps they have the same health goals or similar health goals as you. That's also been shown to be very, very helpful when, especially trying to maintain behaviors that are going to help achieve that best weight and maintain it. So there's a lot of treatment options available for elevated weight. Obesity is considered a real medical condition. It's not just having elevated weight, it's all of the factors that come along. In fact, you can still be in the overweight or obese category and still be considered metabolically healthy, and at maybe even at your best weight. But when you do have obesity, which is the multifaceted problems that come with it, then that's when we have many different treatment options available. Our program, of course, focuses on two of three of those. So we'll go over the options. So there's the behavior change therapy side of things. So from the mental health aspect, the physical health aspect for like nutrition and exercise, and building healthy habits around that. And then you have your medications. Again, that is what's also offered in this program. Medications have been that are approved by Health Canada have been shown to be very effective for weight loss, specifically those weight loss medications. And then we have our third option, which is surgery. And some individuals perhaps will just go with surgery and behavior change. Behavior change is pretty much something that's necessary for all three of these categories, regardless. So they might have surgery and behavior change therapy, or they might have medication and behavior change therapy, or they might decide to just have the behavior change therapy. But either way, those are the three options that we have that are actually research based for obesity. So again, as I was saying about Jack and Jill's weight loss program, we mainly focus on the top two. So again, we have Health Canada approved weight loss medications. Again, those are ones that have been shown to be effective for weight loss, and they are safe for weight loss. And we also have the behavior change therapy aspect of it, where again, we're working on many different things with you, your mental health, your nutrition, your physical activity. And you also then get that monitoring and support from those licensed health care providers like the nurse practitioners. You'll be have access to the registered dietitians, the registered kinesiologists, and psychotherapists, social workers, all licensed healthcare providers. And for some of you, you might also be in touch with a doctor depending on where you are. Um, so really, we try and take a holistic approach to things to ensure that not only are you achieving your weight loss goals, but you're also maintaining your best weight as well. So, what is behavior change therapy, though? So, we kind of talked about it a little bit, but according to the Canadian Adult Obesity Clinic Practice Guidelines, the main goal of psychological and behavior change interventions is to help people living with obesity make changes that are sustainable, that promote positive self esteem and confidence, and that improve health, function, and quality of life. This might be a good time if you have like a notebook or if you just want to reflect a little to kind of consider the following question. What are some healthy habits you are working on or want to start working on while on weight loss medications? So at this time, you can kind of think of some of the things that perhaps might have been barriers in the past that might be going well right now that you've improved on, or perhaps some things that you're still working on right now that maybe will be helpful not only while on the medication, but off of the medication. So you can jot down, or again, you can kind of sort of reflect on this question as well. So let's talk about building resilience. Every successful path to a best weight includes setbacks. So we have to understand that it's not going to be a smooth ride. Weight management and weight loss in general is rarely linear. We do get times where we might go up back in weight, we might come down again, we might be at a plateau for a while, there might be some barriers that pop up that might make it difficult. Really, life, as a client once said, life might be lifing. So many different things can be happening that get in the way, and being prepared for that becomes really important. And that's why building resilience becomes really, really important when it comes to maintaining your lifestyle changes and making those lifestyle changes, being able to bounce back essentially. So things like negative thoughts about past weight loss struggles might sabotage your current ability to move forward, though. So just trying to be able to view this as a new journey rather than comparing it to old journeys can be helpful. Weight loss can look different at each stage, or each time that you do it, or try to. And so, really being kind to yourself and understanding that our past struggles or past failures even aren't what make us. What they do is they actually help provide us with valuable experience and lessons to kind of learn from and learn through, in order to actually improve things this time. So uh, kind of leaving those negative thoughts about your past weight loss struggles in the past and kind of focusing on your current ones, while perhaps using some of those things that you might have learned from those past attempts, or at least some of the past failures if you've had any failures with weight loss in the past. Um, Changing your thinking is the process that underlies sustained behavior change. So, really, again, changing how you frame your plateau, how you frame going up a little bit in weight again can be important because there are other amazing aspects that perhaps you might experience while you're in this program, other than what you can see on the scale. And so it's important to be able to reframe that thinking to, okay, perhaps there may have been, some weight gain that occurred, whether it be over the holidays or whether it be during the summertime. However, these are the impacts that I've seen in my blood work. These are the impacts that I've seen with my strength. This is what I've seen with my energy level. Perhaps your energy levels increase. So reframing the way you're thinking about your weight loss efforts can be really important when it comes to building that resilience. So goal setting is an essential piece, I would say. It's one of the most essential pieces to being successful in weight management. We want to be able to create goals that are going to support us in our lifestyle behavior change. So, in making those improvements in your lifestyle and making those improvements in your behaviors that are going to lead to your best weight. And we also want a means of being able to measure our progress, and goals can really help with that. So, when you set a smarter goal is a type of goal that essentially meets the following criteria. So it has to be a specific goal targeted at one action at a time. So try and really hone in on what you want to make change in, what you want to improve. It should be measurable. So try to really include a number in your goal, even if that number is one. So even if you're just saying by the next, by the next week, I want to create at least one list of foods that are high in protein that are going to be my go-to snack ideas. That's an example. It should be action oriented as well. So focusing again on the action rather than the outcomes. Think of that list of foods. Building that list of foods is that action that you're taking. Should be realistic. So really making small goals, doing just above what you're currently already doing. If you are not experienced, for example, in making lists of foods, just one list of food is going to be difficult enough. And so just doing right above what you've currently already been doing is important. Another example of that would be perhaps now you're drinking 5 glasses of water a day, but you want to increase that. So let's maybe perhaps think of increasing it to 6 glasses of water per day by the end of the week. So really making it really, really realistic. And it should be timely, the examples that we just went over. Really focusing on building weekly goals allows you to properly set those goals, review them, revisit them on a weekly basis. It keeps it really relevant, keeps it top of mind. And it will help you be able to even refocus on a goal if you're not as successful with it. So keeping it as timely as possible is really good. And so this is why we recommend kind of keeping it on a weekly basis. Then these smarter goals should meet the criteria of being evaluated. So to evaluate the goal means to just review that progress, like I was saying, on a weekly basis, preferably, so that you can kind of see how far you come essentially, and if you were able to meet that goal or not. And that will allow you with the last criteria, which is that will allow you to reset the goal. So then you can reset it and grow upon your goal over time. Or if you ever need to scale it back, say if things didn't go as planned, then you can always scale it back as well. And you can always refocus on a goal if it was difficult enough. So let's go over some key messages. So weight bias is real and has negative consequences. It is something that impacts our ability to really enjoy life. And so, really, what we want to do is bring about more awareness around the concept of best weight. So, really, considering your best weight is important, understanding the weight that makes you feel healthiest and happiest, that's reasonable to sustain. Obesity is a chronic condition also that is influenced by many different factors, by our genes and our environment. Weight loss medication combined with behavior change strategies is a powerful and evidence-based treatment. If you look at any of the medications, every single one of them says that they work best when paired with improvements in your lifestyle, like exercise and nutrition. They will all recommend that. And also, the sustainable weight loss is possible, but with the right tools. So again, we want to make sure that we are supported in our weight loss and maintenance efforts, as that's going to allow it to be more sustainable. And so having the right tools to be supported with that is very important. And just, it's important to really understand that setbacks are a part of the journey, but despite them being part of the journey, it's important to acknowledge and continue to move forward. Here are the references. Such a interesting slide to look at. And usually we have some time for Q&A. However, if you have any questions after watching this video, feel free to email your dietitian. Just note it does take us usually up to 48 hours in order to get our emails back to clients. 48 hours actually maximum. So if your dietitian is Jill, who covers Ontario, Manitoba, and Saskatchewan, there's her email address. There's Alana's address for Alberta clients, and then there's mine at the end for BC, New Brunswick, Newfoundland, the Nunavut, Northwest Territories, and Yukon. So feel free to email me with any of your questions. Thank you so much for watching this video, and hopefully I'll be speaking with you sometime in the near future. Take care. Bye.